we just talking about it more? Or does it feel like there are so many more allergies around? Is it trendy to have an allergy?
It is a pain in the behind. But you're right. Allergies are on the increase.
I look really good when I've got hay fever. Look a bit like Gollum. When I go and get my hair done, they'll do a little patch test on the back of my neck. And is that necessary? Because I always find it a bit of a faff.
I can't tell you the number of men and women I have seen in clinic who have come in and their whole scalp is just
fascinating. Welcome to No Appointment Necessary. My name is Cherry Healey and I am with a real life GP.
And I'm Dr. Amir Khan, an NHS GP up in Bradford. But you don't have to come all the way up there to see me. You can join me right here every week on this podcast.
Dr. Amir, we've got our first sponsor.
I know.
It's so exciting.
Very exciting.
It's official. So Randox Health are offering blood tests. They're called the Everyman and Everywoman check, and they're going to measure up to 150 biomarkers, giving you a complete idea of what's going on inside.
Yeah, and if you're wondering what a biomarker is, it's lots of different things, and it can be things like your blood sugar, your cholesterol, your liver function test, your kidney function test, and actually knowing these kind of things might be one of the smartest ways to stay on top of your health, so you can make changes that support your long-term health.
And did you know that once you've done the test, it only takes 2 hours to get the results?
What?
Takes me longer to get my hair done.
It takes me longer to get ready in the morning. Right. But you'll also get a follow-up test 6 months later so you can track your progress and see all those differences you've made in your lifestyle, see if they're making a difference at all. And the best bit, which is going to put me out of a job, you don't need a GP referral. You can just make an appointment yourself.
We're all about no appointments, aren't we? And it's so fab because there's a code you can use to get 15% off, and it's NAN15, no appointment necessary 15. It brings us joy that that's our abbreviation. So NAN15 to get 15% off on your Everyman or Everywoman health check. Test today, know today with Randox Health. But don't snooze because it's only valid until 30th of November.
Yeah, you've got to be quick. Just go to randoxhealth.com for all the information you need.
No subject is off the table, and today we're talking about allergies. What is the difference between an allergy and an intolerance? Does it feel like there's more allergies around than ever before? What is going on with allergies? Is it trendy to have an allergy?
It's not trendy to have an allergy. It is a pain in the behind to have a true allergy, I would say. But you're right. Allergies are on the increase, and there's probably a number of reasons for this. The first one is we're getting better at recognising them and diagnosing them, whether that's GPs, schools, parents. We pick them up earlier and we can test for them earlier, more so than ever before. But also, our lifestyles and our environments have changed, and that has increased the risk of allergies. For example, our diets have changed. There's more ultra-processed foods, refined sugar, additives. All of those things affect the gut microbiome. And the gut microbiome helps regulate our immune system. It stops it from overreacting, but it also stops it from underreacting. But if it's off balance because of the food we're eating, then it can overreact. And that often is what an allergy is, your immune system overreacting.
What happens in the body when you have an allergy?
So an allergy is your immune system overreacting to something that should be harmless. So whether it is peanuts, shellfish, eggs, whatever, it perceives it as harmful, a threat, and it launches a massive attack. And all of that can cause the release of chemicals like histamine. And allergic reactions can range from relatively mild to hay fever kind of things, like a snotty nose, runny eyes, to really serious anaphylaxis where your airways close, your blood pressure drops, your heart stops. Those are really serious. So people need to take allergies seriously. You always have that uncle, don't you? You go, oh, just try a little bit. It's not going to do you any harm. Yes, uncle, it can. It can kill them. Don't do it.
Why, if the body's trying to protect you, does it have such a strong reaction? It's like your heart stops. Surely it's the body getting confused?
Well, that immune response, it's like a cascade of events. So you've got an over-responsive immune system that perceives danger And then all these chemicals go off that widen your blood vessels, drop your blood pressure, and your body can't perfuse your organs because your blood pressure drops
What
so low.
does perfuse mean?
So it can't get blood and oxygen to your organs because the pressure is so low. Or you might get swelling. All that histamine can cause swelling of the lips, the tongue, the airways, your lungs, the tubes within the lungs narrow because all of that histamine is causing that immune response, and that causes wheeziness, and eventually, your airways can...
It's a bit of a system breakdown, isn't it?
Totally.
It's like your body's trying to do the right thing, but it presses the wrong button and its computer crashes.
Totally, exactly that.
What is histamine? Because when we have allergies, I get hay fever, I take an antihistamine. What is histamine?
So histamine is a normal chemical messenger within our body. It does lots of things. It can control how much acid our stomach produces. It can help with our sleep-wake cycle in our brains as well. But it also helps with our immune response. And normal levels of histamine help us deal with infections, particularly parasites, things that are coming into our body that shouldn't be there.
Right.
When you have an allergic reaction, remember your body is overreacting to a harmless thing.
Like pollen in my nose.
Like
it's
pollen
going,
in your nose. Yes. So histamine then gets overproduced because your immune system's going, oh my God. Too much histamine binds to something called mast cells, which are part of our airways, and it can cause all these chemicals to then be released, including an immunoglobulin called IgE. Now, this is just a type of immune response, essentially. And what that does is start off another cascade of events that causes your blood vessels to dilate in your nose, your eyes. It causes increased secretion and inflammation. And your body tries to get rid of it. That's why your nose runs and your eyes run, because it's trying to get rid of whatever
it's a really good look. I look really good when I've got hay fever. Look a bit like Gollum.
Yeah.
Just a heartbroken Gollum.
Yeah, sexy, really
sexy.
Hot.
Really hot.
Did you develop hay fever as a child or as an
Later.
adult? Yeah.
What is that about?
So there's several different reasons that can happen. Firstly, our immune systems are never static. So you can become allergic. Your immune system can over-respond to anything at any time. So just because I've not got an allergy now doesn't mean I might not have one in the future. When it comes to the immune system and responses, it can have a threshold. It's a bit like a bucket of water. You can fill it, and everything's fine. But if you overfill it, then things spill out. And it's a bit like that with the immune system. If there's really high levels of pollen, you've filled your bucket, and then you can respond to it. And we are seeing with climate change, we're seeing longer pollen seasons, aren't we?
But different environments can then cause different responses later on in life.
Totally. There's this theory, the hygiene theory, where things are just too clean and young people, children, babies aren't exposed to microbes in the same way that they used to be, which used to help train and tolerate your immune system. There's certainly not as much outdoor play, as much animal contact, and those are the kind of microbes that do help train our immune system not to over-respond. One more thing I would say is there's this old-fashioned advice which was not to give babies allergic type food like peanuts, eggs, shellfish too early, and we were leaving it too late. Whereas now the newer evidence is actually giving it earlier on in the weaning process is the right approach. And that kind of old advice could have led to more allergies. Weaning children is a key moment when it comes to allergies. So it used to be, we all said, don't give them hyperallergenic food until their immune system and gut has matured. And lots of people were putting off giving things like peanuts and whatever until they were 12 months or more.
Yeah, weaning your child is actually really scary. I'm not a scaredy cat, but it's really terrifying.
Yes, but actually that was the wrong advice. And there's a study called the LEAP study, which stands for Learning Early About Peanut Allergy, where they took 600 infants who are at high risk of peanut allergy. So they might have had eczema or another condition which puts them at risk of allergies. And they gave some of them peanuts from an early age, between 4 and 11 months, and then others were kept off peanuts till they were much older. And actually, giving peanuts earlier, that 4 to 11 month stage, reduced the risk of peanut allergy by a massive 80%.
Okay.
So
right. I mean, that's conclusive. Would you say that's conclusive?
That's what we're saying now. We should get these hyperallergenic foods in earlier.
Haven't they now got a peanut? They've got an amazing bit of peanut research where people who are hugely allergic to peanuts are now introduced with teeny tiny doses. Apparently it's working a treat. So people who suffered with very intense peanut allergy are being cured?
Yeah, not necessarily cured. So it's a type of immunotherapy for children at the moment. So it's run by the NHS and a foundation called the Natasha Allergy Foundation. Natasha was this poor girl who sadly died from a exposure to sesame seeds. The packaging wasn't labelled properly and she sadly passed away. But her parents have set up this research foundation.
What an amazing thing to do.
Yeah. I've met those parents.
Are they incredible?
So incredible.
Right.
Now, what they're doing with this research, and we haven't got the full results yet. The full results will be out in 2027, but the preliminary results are really positive. It's a type of immunotherapy, training the immune system to tolerate peanuts. They're doing it specifically with peanuts, and they're microdosing these children under very strict medical supervision in clinics with small amounts of peanuts, gradually building it up. And the idea isn't to necessarily cure them, even though some of these children are now able to eat peanuts. It's about them not having a full-blown anaphylaxis reaction. So they might have a milder reaction, but not a life-threatening reaction. And the results are really promising.
I had a documentary on the radio about it, and I was, when you're driving and you just think, God, I hope I don't crash, because it was absolutely blew me away what they've achieved.
But I think what often gets confused in language when it comes to allergies is the difference between an allergy and an intolerance. And not many people really understand it. So an allergy is when your immune system is involved, that immune response over-responding to something that it shouldn't be. Whereas an intolerance doesn't involve the immune system at all. It usually involves some kind of food and a problem with digesting that food. For example, someone who is lactose intolerant, their immune system isn't involved in that. What's happening is they're usually missing a key enzyme that helps them break down lactose. So the lactose stays in their system and causes all that gas, bloating, stomach cramps, diarrhea. So it's very different. It's not the immune system over.
Is that why if you've got an allergy, you can take medication to counteract that? But if you have an intolerance, you can't take, if you're gluten intolerant, you can't take a pill. Is that right?
Yes. So gluten is a funny one. So you're absolutely right. For allergies, particularly mild allergies, antihistamines are really good. Gluten is a funny one because people can be gluten intolerant, which is very different to having celiac disease, which is different to an allergy and an intolerance. It's an autoimmune condition.
Right.
That is when your body sees a protein in gluten, which is found in wheat, barley, rye, as a real threat. And it starts attacking the gluten, but as well as that, it doesn't switch itself off once that gluten's gone. So it starts attacking parts of your intestine, particularly your small intestine. Ow. And it's really horrible. So that's an autoimmune. Your immune system has gone into even more overdrive in a different way to an allergy.
If you're a celiac and you do have some gluten and that is starting to happen, A, is it really painful? And B, what can you do?
So it can be really painful. Usually it's diarrhea, bloatedness, all of those things that come with it. And there's not much you can do. Unless you're very unwell, you need to go into hospital for things like fluids. There's very little you can do until your immune system calms down. So the only treatment for celiac disease is an absolute abstinence from gluten.
For someone who has an extreme allergy against peanuts, which is obviously very dangerous, what role does histamine play in that? Is that still going on?
It's still going on because that's what triggers a lot of that big anaphylaxis. That's the thing that triggers all the other chemicals to go into overdrive, cause your blood vessels to widen, cause your blood pressure to drop, cause your airways to narrow. All of that plays a big response. The problem is an antihistamine is like dropping a tiny pill in a massive ocean.
Right.
That's not going to work for an anaphylaxis. What you need is adrenaline. You need your EpiPen. So people who are known to have anaphylaxis or at risk of anaphylaxis should, via their doctor, be carrying EpiPens around with them.
How do you administer an EpiPen? I think it's really good for us all to know if you see someone having a really bad allergy and allergic reaction, and they give you their EpiPen. What do you do?
It's really easy. So the instructions should be on the pen itself. One side will have the needle in within a plastic coating, and the other side will have a lid. All you have to do generally is take the lid off, and it will tell you on the pen which side is which. Take the lid off, and then you don't have to do anything else apart from press the pen with the needle side into the top of the thigh. That is it. It will do the rest. You'll hear a click, and it's gone in. That is it. Just make sure you get the right end. Nuts, for lots of people, if they've got a severe allergy, just being in the room where the dust of the nut can become airborne can trigger off an allergy.
Which is why on planes now you have little pretzels, which I actually much prefer.
The people who moan about not being able to eat nuts, your inconvenience is nothing compared to someone's life.
I don't know if we take it seriously enough.
We don't take it seriously enough. And I think there's so many examples of where, sadly, people haven't taken it seriously, or it hasn't been labelled correctly because those people haven't taken it seriously and they've prepared food in the same kitchens and blah, 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 blah. And sadly, someone has died as a result. We need to take allergies far more seriously.
I actually just went to a factory to do some filming, and I'm not allowed to say where, but they had a gluten-free factory, a separate factory, and their standards were immaculate, and I was really pleased to see it. Different outfits, different uniforms, kept completely different buildings. They took it so seriously, and I thought, oh, that's wonderful.
Yes.
If you're really gluten intolerant, it can be incredibly serious.
Yes. Gluten intolerance is not necessarily serious as in medically serious, but it can be very uncomfortable.
Very.
But celiac disease is different. That is serious.
Right.
If you eat gluten regularly, if you have celiac disease, it can increase your risk of bowel cancer, because all that damage from the gluten over time, all that inflammation can lead to cell mutation and lead to very specific type of small bowel cancers.
Are there herbal remedies or lifestyle changes that you can initiate to reduce allergies and intolerances?
No, absolutely not. Don't trust anyone who says they are going to cure your allergy through some kind of herbal
Here's
tea.
my magic pill. It's only $10.99.
Snake oil, definitely. So we have to go on the evidence. And currently, what we know is that with food allergies, you have to avoid them, or we're now looking at this microdosing. But what I would say, which often people don't do, if you've got hay fever, Cherry, when do you start taking your medication?
Oh, I like to take it at the beginning of the day. I take it before I've even become allergic.
That's not what I mean. So tell me when in the season you start taking it.
Oh, when I start to get itchy scratchy.
That's wrong.
Why?
Because you're already itchy scratchy. You need to start taking your hay fever medication 2 to 4 weeks before hay fever starts.
But really?
Yes, because remember, you are trying to calm your immune system down.
I'm trying for the bucket not to get full.
Yes. So if you start getting hay fever in March, April time, which is really common,
yes,
you need to start taking your hay fever medication in February.
Do I?
Yes.
And then I won't get itchy scratchy at all.
Well, a lot less.
A lot less.
And it depends on your symptoms. The best thing to take if you've got nasal eye symptoms are the nasal sprays. Take them early. Don't wait for your symptoms. So a lot of these nasal sprays have either antihistamines in or steroid medication in. And that reduces the risk of your immune system overreacting. Tell me how you take your nasal spray, Cherry. Do you take a nasal spray?
I take the whole lot when I'm...
Talk to me about your nasal spray. How do you take it?
So you get it,
yeah,
and you stick it up your nose, and you go, and then you have to go, because it's really stingy, and that's how I take it.
Straight up?
Straight up.
Wrong.
How many ways are there to take a nasal spray?
You have to
have your leg up. And how can you take a nasal spray differently?
It doesn't go up. If you spray upwards, all you do is swallow it, and it just goes down.
Oh, and it's awful.
It's horrible.
It's awful.
You have to go inwards like that.
No,
it's the blood vessels on the inside of your nose that are causing the problem. So you've got to point it inwards. 2 to 4 weeks. So start in February. Point inwards.
Fascinating.
Yes.
Everybody
does it wrong. Everybody does it wrong. Honestly.
Me and my daughter were there with our nasal sprays, like both just shooting up. Or down it goes.
Down it goes.
Pointless.
Doesn't work.
Actually pointless.
Yeah.
What about eye drops? Because I get really scratchy eyes.
You're probably better off taking antihistamines than you are eye drops,
Right.
because it will help with the watering of the eyes more so. But if you struggle with tablets or your antihistamines aren't helping, then eye drops are good. All you're trying to do with antihistamines and all of these things is stabilize your immune system so it doesn't go into overdrive.
The thing I did discover this year, which I really enjoyed, it was this little pot I got from a pharmacist. It's just like it's like ointment, really, it's Vaseline. And I put that around my eyes.
Yeah.
It just, it felt really nice, but I did seem to get less scratchy eyes.
Totally. Because
what was that about?
The pollen will stick to it, so it doesn't go into your eyes. So when all that pollen is floating around, it sticks to that ointment rather than going inside of your eyes.
That worked a treat, you know.
You can put it around your nose as well.
Yes.
Yes. And
it was
then you won't
everywhere.
breathe it
Slathered in
so
it.
much.
Bathed in ointment.
Yes, I think it's really useful. All of those kind of old-fashioned tips are useful. You know, coming into the house, having a shower, changing your clothes, making sure the windows are closed, not open, because pollen will drift in.
Yes.
All of that really helps.
Can we talk about eczema and psoriasis? So when my son was born, he had terrible, terrible eczema everywhere. I was like importing these special lotions from America. He was constantly bathed in... I remember when it all started to go, I remember thinking, oh, that's what you look like.
Yeah.
Doesn't have it at all now, not asthmatic.
Good.
I've got a friend who's got terrible psoriasis on their elbows. What's the difference?
Eczema is generally an over-response to very dry skin. So you're not producing as many kind of oils on your skin. And as a result, the skin becomes very dry. That triggers that over-immune response. And then it starts to break and get very itchy, and the itching kind of repeats that cycle of dryness. It's usually in response to something. It can be a chemical that you're coming into contact with. Very rarely, it can be something you've eaten. We see that in babies and children a lot, but less so in adults. It's usually something the skin has come into contact with. That is why emollients and moisturizers are really good, because they restore that moisture.
Almost like a barrier between whatever's annoying them.
Totally. Psoriasis is not an allergic response. Psoriasis is an autoimmune condition where something, and we're not quite sure what, triggers your immune system to go into overdrive. And what it does in psoriasis is cause rapid cell division on the surface of the skin. So you get those plaques formed, pinky, silvery plaques, because the cells are just turning over so fast and you get that overgrowth of the
And it's
skin.
really, whenever my friend drinks alcohol or has a cheeky cigarette or is stressed, that it gets really, really bad.
Yeah. Anyone with an autoimmune condition will tell you lifestyle really affects it. So remember, our immune system is so sensitive to so many things, and our gut health is linked to it as well. And stress affects the gut. All of those things trigger an over-response of the immune system, and it can cause or worsen psoriasis.
So if someone's trying to sell you a herbal remedy for allergies and intolerances, run away. But lifestyle can help.
Yes. Trying to de-stress, which is the hardest thing to do when you're stressed, is really important. But those kind of breathing exercises, relaxation, sleep, managing your cortisol levels are really helpful. Cortisol really affects your gut health. Your gut produces almost 70% of your immune system, and it regulates it. So everything is linked.
Is that why, sorry to be a bit gross, is that why when you're really stressed and nervous or really sad, you get diarrhea?
Yeah, you poo your pants. Yes.
I was really heartbroken a couple of years ago, and I was proper bummed out, like so down. Like I didn't know you could get that down about something like that. So down. And my digestive system was all over the place. I got really unwell.
Yeah.
I was so amazed that your emotions can impact your physiology so intensely.
And when you're feeling like that, you've got the cortisol, which is affecting your gut health. You're not going to be sleeping so well because you're so down. Sleep then affects your gut health as well. And you might not be motivated to exercise, or because you're feeling so down, you want to eat comfort food as well, rather than healthy food. And
triangle-shaped crisps.
Yes.
I'm not going to mention the brand, but we all know what I'm talking about.
So all of that adds up into that kind of gut health and then your immune system.
So if you suffer from allergies and intolerances, is taking a prebiotic or a probiotic a good idea?
Getting your gut health to as diverse and healthy as possible is a really good thing to do. It's not going to replace medication should you need it. And it's certainly not going to replace EpiPens if you ever need them. But if you want to kind of modulate your immune system, so remember what your gut does to a lot of fiber is break it down to something called short-chain fatty acids. And those short-chain fatty acids are what helps regulate your immune system. And that is why your gut health is so important. So eating fiber, the probiotics, prebiotics things, people can get fixated on it. What you really need is just a variety of plants, lots of different colours, keep the skin on, and fermented food.
So with microdosing, does it work with other things?
I would say no, because this is very early research and everything is being done under very strict medical supervision in clinics. So these children are being given these peanuts, but being observed. All the safety equipment is around them. If you're at home thinking, oh, if those kids are all right, I'm going to have a peanut as well. Absolutely not. Do not do it. That is not what this is. They are carefully constructed, tiny doses that are built up. You will not be able to recreate that at home. So please do not do it.
What is in hair bleach that irritates people? Because when I go and get my hair done, sometimes if it's a new salon, they'll do a little patch test on the back of my neck.
So
and is that necessary? Because I always find it a bit of a faff.
It is a faff. And when I'm sitting in the hairdressers getting my hair cut, I can see people coming and going, I want to have a colour done. And they go, well, you'll have to book in for a test first. And then this and you can see them roll their eyes. However,
that's me going, I don't need it.
Honestly, you do need it. As a doctor, I can't tell you the number of men and women I have seen in clinic who have gone home, dyed their hair, not tested anything, just used a bottle at home, even at the hairdressers, and have come in and their whole scalp is just bright red, falling apart, coming all the way down to their eyebrows, awful, behind their ears, on top of their ears, the most painful, itchy thing. And it gets infected. It lasts for weeks. Oof. You have to give them steroid medication, oral and topical. It just goes on and on and on. So absolutely get that skin patch.
Don't roll those eyes.
Don't roll those eyes.
Just off with your little neck. Be on your merry way. I didn't realise it was so serious.
Yeah.
What is it? What's in it? What's in hair dye?
It will be different for each person. So every person won't be allergic to the same thing in that hair dye. So even if you are fine with other hair dyes, doesn't mean you're going to be fine with this hair dye.
The ingredients can be really different.
Totally. So always test it. It's just not worth it.
And also those chemicals are strong. I mean, it's actually changing the colour of your hair.
Yeah.
Like it's going to have a punch.
Yeah. And if you think, well, I'm not allergic to anything, so why would I be allergic to that? Remember, your immune system isn't static. You could be allergic at any time.
What about something like henna, which is you'd think of as fairly mild?
Yes. Most people will be fine with henna, but again, test first because you just don't know. If you've never had it before, if your immune system's seeing it for the first time, and depending on how else you're feeling and how else your immune system is doing that day, you don't know how you're going to respond to it.
There's so much more to allergies than I thought. I'm really, and actually just taking them seriously. And if your friend's intolerant or allergic to something, just be their friend and take it seriously.
Yes, don't push them to try something. So
we've been talking a lot today about allergies, but another thing that can be really annoying is itchy scalp.
Yeah, you can get dermatitis, which can give you an itchy scalp, which is really useful because our next sponsor is actually Polytar. And actually what they're saying is that it might not be a you problem. It could be a water problem, the water you're using, because 13 million UK households have hard water. That means it's full of minerals and that can irritate and dry out your scalp. And what Polytar are calling this is an epidemic. It's called the scalp shame epidemic.
Oh, it's so awful if your hair and your head is not feeling okay.
We're not shaming. We're not shaming. But we understand it can feel embarrassing.
It's not fun.
No, it's not. 1 in 4 people have avoided social situations because of flakiness and itchiness. Now, this shampoo, Polytar shampoo, has been used by doctors for many, many years, including myself.
Have you prescribed it?
I can prescribe it and I have prescribed
Really?
it. Yeah, it does contain 4% coal tar, which helps soothe irritation, reduce flaking and treat the cause, not just mask the symptoms. And you can use it for things like dandruff, psoriasis, seborrheic dermatitis. And it's particularly useful if you live in an area with hard water, which you do.
I really
right, Terry?
do. I really do. This is good to know that this is out there if I start to suffer. You can also read a full hard water hair report at polytar.co.uk. And our listeners get 10% off with the code appointment15.
Oh, I love that. So remember, it might not be you. If your scalp is irritated, flaky or sore, it might be your water. And there are things that can help.
It is now time for Chat GP.
This bit makes me really nervous.
I know.
Because as I've said before, I have no idea what you're going to ask me, like genuinely.
It makes me really entertained that you're so nervous because you know so much.
Oh, go on.
Okay. Laura says, is it safe to take a laxative every night if you can't poo regularly? Oh, that's a good question.
I would say no, Laura. You've got to find out why you're not pooing regularly. Why are you constipated? Is it diet related? Is it you're not doing enough exercise? Is it stress related? Is it you're not drinking enough water? Are you on medication that is making you constipated? So you've got to make sure that is not the issue. I would say if you're not going to the loo every day or every couple of days or whatever's normal for you, you need to look at your diet. Water and fibre are your best friends. I wouldn't take laxatives regularly unless I have ruled out all those other things or I know I've got a medical condition that makes me constipated. That is the only time I would give someone regular laxatives. Otherwise, you've diet, water.
What's bad about taking laxatives every day?
Well, your body gets reliant on them. So depending on what laxative you're taking, it could be a stool softener, which isn't as bad, but it could be a stimulant as well, something that makes your bowels push out poo, and your bowels can get reliant on that. So when you do try and come off it, you are properly constipated.
When I had my children, I had a cesarean and they gave me very, very strong painkillers. I think it was codeine. And they made me really constipated.
Yeah.
And it is so miserable.
It's horrible.
But then the laxatives gave me tummy aches.
Yeah, but that's a temporary thing, isn't it? If you're on codeine,
Right.
then that, if you're on medication, you
but actually,
know the
it was so
cause.
uncomfortable that I decided to stop taking the codeine and just deal with the pain because it was just, it was all bunged up. Moving on from poo. Amy says, I'm in my 40s and noticing my hair is getting really thin. I mean, really thin, full stop. I've seen shampoos that say they will help, but will they? Why is this happening to me? Another great question.
Yes. It's the good old perimenopause can cause hair loss. So that drop in estrogen can seriously affect your hair. And we see lots of women coming in with thinning hair as a concern.
Absolutely.
It can be other things as well. Stress can cause hair loss. So if you're stressed, that can be part of the issue. But if someone is coming in with hair loss to see me, I would do a number of tests. So if it's the menopause, I would ask them about that. I always check their iron levels. You've got to have relatively high iron levels to maintain a good scalp of hair. And I don't mean just kind of low end normal. I mean like really top end. So have a think, could your iron levels be low? And lots of women do because they menstruate. But we check their iron levels and because it's normal but low normal, we go, oh, well, that's fine. And off they go. But actually, low normal is not good enough for hair loss. You need high normal.
That is such golden information. Why do we not all know that?
Oh,
quickly, how do I up my iron?
So diet. So you could get it from red meat. If you eat red meat, don't eat it more than once a week because it can increase your risk of bowel cancer. But dark green leafy vegetables, honestly,
Yum.
They are the source of most good things. And I would always say, have a think about your thyroid as well. You could have an underactive thyroid that can cause hair loss. So those are the tests I do as a GP if a lady or a man comes in with hair loss. With men, it's usually male pattern baldness, so they don't get the test like the women do.
They get different treatment.
Yeah.
They go to Turkey, don't they?
Sorry. Yeah.
They go to Turkey.
They go to Turkey, yes.
No, I think male pattern baldness is actually miserable.
Yeah, of course.
For so many.
Yeah.
Wonderful advice as always. It is now time for our health hack. Have you got a golden nugget for people?
I have. I tell you what I'm obsessed with right now are omega-3 fatty acids, which are good fats. They're the type of fats your body needs for good brain health. Particularly as you get older, you need them because it can reduce your risk of dementia. Your body can't make them themselves. You've got to get it from your food. So if you eat fish, you need to be eating fish twice a week, according to the NHS, and I would agree with that. One portion of those fish should be oily fish like salmon, mackerel. If you're not a big fish eater, you can get omega-3 fatty acids from things like walnuts, flax seeds, and chia seeds. The body's not brilliant at getting omega-3 fatty acids from plant sources, so you have to have quite a lot of them to get an equivalent amount. I'm a vegetarian, so I feel a bit bad recommending fish, but it is really good for you. Now, wait a minute, Cherry. Before we finish today, I need to ask, did you follow my sleep hack advice and how did it help?
I just don't want to talk about it right now. It didn't go very well.
What do you mean?
I can't look at you and lie. So I'm just going to say, let's talk about it another day. We've got things to do.
Okay, we'll give it more time.
Okay. Thank you. Sadly, that is all we have time for on this episode of No Appointment Necessary. But as always, we would love to hear from you. Feel free to WhatsApp us or email us. All of the details are in the show notes. And please listen and subscribe on Apple or on Spotify or wherever you get your podcasts. And of course, on YouTube, you can watch, listen, and don't forget to subscribe.
Yes, please do. See you next week. And remember, no appointment necessary.